My name is Jeffrey Pender. I'm the Associate Medical Director of the Pediatric Emergency Department at St. Joseph's Children's Hospital. Parents often ask when is the appropriate time to bring their child to the emergency department. And while this is a difficult question to answer, I'll try to give them some guidelines. First and foremost, if a parent is ever concerned about their child's health or safety, they certainly should come. We're open 24 hours a day to help them. We do encourage families to call their primary care doctor if they have any questions about whether an emergency department visit is correct for them, and their primary care doctor can give them some advice on whether or not that visit is necessary. Bringing your child to the emergency department certainly has advantages and disadvantages. The most obvious disadvantage is that children are scared and families are scared. The emergency department visit tends to be one of great anxiety for families and patients alike. However, it can be viewed positively as well. Our job is to not only diagnose our child, but to treat them and make them feel better. Many children understand, if you discuss it with them beforehand, that you're doing something to help them, and that tends to relieve their anxiety. Also, we have child life specialists that specifically are dedicated toward facilitating that process and making children feel more comfortable and at ease. When parents bring their child to the emergency department at St. Joseph's Children's Hospital, we recommend they bring a few things. First, they want to bring with them any relevant medical historical information if they don't already know that off the top of their head. Secondly, they should bring a list of medications the child's on as well as the proper dosages. And lastly, they should bring something to help entertain their child. We know that children get restless during an emergency department visit. It's important that they're entertained properly. When a parent brings their child to the emergency department at St. Joseph's Children's Hospital, they're greeted initially by a pediatric emergency nurse who obtains their initial history and vital sign information. The patient is then brought back into a private room where she's seen by a pediatric emergency physician. The physician then determines the diagnostic testing and treatment course that that individual patient requires. Then upon completion of that testing or treatment, the physician then determines whether the child requires admission to the hospital or is stable for discharge home. We focus on seeing patients quickly and efficiently, not only so we can initiate the proper medical care, but also because we realize that parents' time is valuable too. I've worked in several different emergency departments over my career, and I can say without a doubt that the medical care at St. Joseph's Pediatric Emergency Department is second to none.